So as prosthodontists, we are around general dentists and general practice to be able to provide our services where they feel they can't cope with a case. If it's too extensive, too many teeth missing, too many broken down teeth, the bite is not there anymore because of missing teeth having drifted and jaw positions have changed. So as prosthodontists, we're trained to seek out those problems, correct those problems. And very often prosthodontists work with orthodontists. So sometimes that can even be general dentists that provide aligner treatments to get the teeth in the right place before we start replacing missing teeth. Other team members that we work with are also periodontists, gum specialists, very important to get the foundations healthy, and endodontists, root canal specialists, in order to eliminate disease within teeth, where we consider saving teeth. And although I do dental implants, I sometimes get a strange sideways look from a patient when I actually tell them, you should save that tooth and not have a dental implant yet. Please go and see a root canal specialist, and then we will provide you with a crown. So saving teeth is essential where we can actually do so.